My name is Muhayuddin. I am final year DBM student in US. Today my topic of presentation is large ovary syndrome in cattle. So the introduction. So large ovary syndrome is simply abnormal enlargement of one or both ovaries, and the causes include ovarian cyst, granulosa thecal cell tumor, ovarian abscess, hematoma, ovarian adhesions, and in minor causes it included ophritis, periophritis, or the inflammation of the tissues that is covering the ovary. And this condition is oftenly detected during the postpartum reproductive exam by the field veterinarians mostly. So the clinical signs related to this condition, the most common clinical sign is anestrus. Other signs are repeat breeding, nymphomania, means the cow come into heat again and again with a short interval, mostly in the cases of GCT. Usually there are no systemic illness or signs, no fever, and there is a normal appetite present. Contralateral ovary often inactive. The inactivity of the contralateral ovary is due to the release of anti-Mullerian hormone by the intact ovary. So the diagnostic methods we use to diagnose these conditions is the transtectal palpation, in which we confirm the size, firmness, and ability to make a differential diagnosis. Ultrasonography, we check the internal structures present on ovary, either they are fluctuating, either they are hard or something else. In a vaginal examination, if there is a condition of cervicitis, inflammation of cervix, or urovagina due to the poor confirmation there and leading to this condition, if possible. The hormonal tests we perform here, we have to check the, if we check the profiles of progesterone or anti-Mullerian hormone, we can make a diagnose, or we can make a diagnosis about this condition. And the last one is histopathology. Histopathology, if there is a hemorrhage is present with the cells inside the cells, or according to the cells, their hemorrhages, their condition, the ovarian hematoma, if that pass in, it will diagnose about the ovarian abscess and cell proliferation. It will definitely due to the cyst. Ultrasound features of the condition. Ultrasound condition, so let make a differential diagnosis on the basis of ultrasound. So in case of GCT, honeycomb appearance and multilobular appearance, as you are seeing in condition D, you can see that there is a multilobular appearance. Ovarian abscess, due to the stage of the maturation of the abscess, there will be the different echogenicity of the ultrasound, and as in case of C you are seeing here, it's a kind of mature abscess. Ovarian hematoma, the blood filled central cavity, and there is a fibrin deposit is there, making it different from the cyst that is only a water of bag, or only an aqueous structure completely in case of, and a large structure. Histopathological finding, GCT, irregular follicles, variable cell density is there, and abscess, there will be inflammatory cells present there, and pus is also there. Hematoma, hemorrhages, and necrotized cells are there, confirming about the condition of hematoma. So histopathological findings confirm the final diagnosis with higher accuracy. Moving toward the treatment, in treatment here we have to perform hemoavarivectomy via flank laparotomy in a standing position, and 95% of the cases are recovered by this kind of approach. Post-operative, we have to use antibiotics to and remove the suture after 14 days. Outcome and conclusion, in short term outcome, there is the return of the cow to the high milk to the milk production is the short term outcomes, and in long terms, if we talk about she will get bred or ready for the conception within a 2 months. Early prognosis, early diagnosis improve the prognosis, and untreated conditions of the large ovary syndrome in cattle worsen the fertility and affect the production of your herd or production of the cow. Thank you for your attention. If you have any question related to this presentation, you are welcome to ask.